what I have learned is that those other aspects, medical education, leadership, advocacy, are shaped by your experiences as a physician, but they also shape you as a physician.
Welcome to Specialty Cafe, a podcast by the Royal College of Physicians and Surgeons of Canada. My name is Mark Yerbedian, and I'll be your host. I'm honored today to be joined by Dr. Laing, who is a medical oncologist. Welcome, Dr. Laing.
Thank you. It's wonderful to be here with you today.
Awesome. So maybe just to start off, can you tell us a bit about your career journey from medical school all the way into your practice as a medical oncologist?
Sure. So I like to tell the current medical students that I'm a medical oncologist from the turn of the century because I started my practice in 1999.
Okay.
So I went to medical school in my home province at Memorial University, and I went there in 1989. And I wasn't sure what I wanted to do when I went to medical school. And as I went through my training, I really became interested in internal medicine. And shortly after doing a rotation in hematology, I really liked caring for patients who had malignancies. And medical oncology was a relatively new subspecialty at that time. So I actually had an opportunity to do an elective in Nova Scotia, where my mom was from, and work with a remarkable colleague named Dr. Ron McCormick. And I knew just then and there that this is what I wanted to do. And so I did my internal medicine at home as well, and then was fortunate to be able to do my medical oncology training at the University of British Columbia. So went from one coast to the other and had a stop on the way back in Kingston and worked with the Canadian Cancer Clinical Trials Group. It was called the NCIC at the time. And all those experiences really shaped me to become an academic medical oncologist, allowed me to go back and practice in my home province, which is where I've stayed now for over 26 years, and really has given me a very rewarding career.
Awesome. And now back in Newfoundland, what does your practice look like in terms of settings and kind of different aspects of your week?
Sure. So I'm an academic medical oncologist. So I work within a cancer care program, which is a provincial cancer care program. And we have a cancer center that's part of our main hospital campus and our university. So I've always had an academic position, starting as an assistant professor and then working my way through now to a full professor. So part of my week involves patient care, and part of my week involves leadership and education. And it's a really remarkable balance between caring for patients, which is my ultimate favorite part of my job, and also allowing me to be a better medical oncologist by being a leader and an educator, and by shaping the next generation of people who will come behind me. And in fact, I would say at least 75% of my colleagues, I trained them. So I was involved with their education, which is really lovely. Yeah.
And so something that I think the medical students on here and myself often, maybe not struggle is the right word, but are often curious about is kind of the difficult conversations in medical oncology and how to approach those. I know, being in clerkship right now, it's something that maybe I find a little bit daunting. How do you kind of go about that? How did you go about gaining those skills, and how do you go about instilling those skills in medical students?
Yeah, I think that's a really important question. And sometimes people think about medical oncology as being a specialty that's sad, and you're always dealing with difficult conversations. And you're right, there are those that occur in medical oncology and throughout medicine. So one of the things, so how I've approached that is I always try and think about making sure that the patient is supported in those conversations. So I put the patient first. So are we in a quiet place? Do they have the support system that they need around them? Do they want to have this conversation? And so that's the first thing. So setting the scene, putting the patient first, and asking what they already know. Every day when I see a new patient, I say, so what have the neurosurgeons or the breast oncologists told you already? Because I think it's important that we understand what our patients already know. And then what would you like to know? And so it's really building those trusting relationships. And then when you have that foundation to really, be able to talk to patients about things that may be difficult. So sometimes it's a new patient and they don't really know what to expect for a treatment plan. It may be an established patient and really talking about a scan that shows progression. So presenting the information in a way they can understand once you know what they already know and what they want to know, And sometimes just taking that time, that pause is often something that's very powerful. And you don't need to feel that space. Sometimes you just need to sit with the patient and let them sit with the news and then make a plan. And I always give patients the opportunity to be sad, to be disappointed, to be angry. And then I say, feel all those emotions. And then when you're ready, let's talk about what we're going to do next. Yeah.
Cool. That's very insightful, and I think that helps. It helps break it down into a structured plan. And when you're systemic, I think it's a great way to go about it. Maybe taking a step back now. So you started out in internal medicine and went into a oncology fellowship, medical oncology fellowship. How did that decision come out? Did you know that you wanted to be a medical oncologist from when you were in medical school? Is that something that you learned when you were?
No, I learned it along the way. Actually, when I applied to do internal medicine, I applied to do internal medicine and family medicine because I knew that I didn't want to be a surgeon.
Yeah.
And then I actually had an interest in geriatric medicine. I had an interest in neurology. So now I actually get to do those in my career because I take care of patients with CNS malignancies. So I think it was that idea. So I think as internal medicine residents, we're very interested. My colleagues tease we're the thinking specialty, right? So we're curious about things. We want to sort things out. We want to make a diagnosis. We want to put all the pieces of the puzzle together. We want to come up with a treatment plan. Oncology is a wonderful specialty to be able to do that in. It has that longitudinal patient care, which I think is something that's really important for me. And so that comes in internal medicine. That can, and many of its subspecialties can come in family care. That just being a part of somebody's life for a long time. And then oncology, when I think back to when I was first in practice, for example, the complexities of caring for patients with breast cancer seemed at the time to be somewhat simple. But the more advances that we have and the more ways we understand cancer and subdivide them and come up with new therapies has made it just the most interesting specialty. There's always something new. There's always something to learn. And I think that's what attracted me to it in the first place. Figuring it out, treating it, caring for the patient, the individual, the family, but also all those new innovations that continue to happen in oncology.
Okay.
Yeah.
And did you have a kind of oncology background before medical school? Did you, in terms of biochemistry or anything like that?
No.
Okay.
I was in the generation, I did 2 years of undergrad and was accepted to medical school. So I didn't have any, at that time, I didn't have any experience in oncology in my undergrad. I didn't have any experience until later of my mom who had a cancer diagnosis.
Okay.
It was working with the then hematologists who cared for patients with lymphomas and leukemias and things that I really became interested in that aspect of things. And then my elective in oncology.
Right.
Yeah.
Okay.
Yeah.
Maybe shifting gears a little bit to the other kind of passion of yours, which is leadership, and you work with the Royal College. Can you talk to us a little bit about that and how you got involved with the Royal College?
Yeah. So it's interesting because I say to people, I think there's two important messages. One is leadership is about opportunity and it's about experience and education. So when I look back to when I was a medical student, I did participate in some committees and I did some leadership work. I didn't really identify it at that time as that's what I was doing. And I think people saw potential in me as a leader. Then when I came back in practice, we had a very high turnover of medical oncologists. So early in my career, I became the director of medical oncology. And I did that work for the first few years almost because I had to and because we needed somebody. And then I realized if I was going to be effective, I needed to build some education around that. So that's when I started to do leadership development. I participated in a lot of Physician Leadership Institute courses that were offered through the CMA, some local leadership opportunities, and then some national and international leadership development opportunities. So I hadn't done any specific work with the Royal College until probably about 7 or 8 years ago when my former chair of medicine and dean said, we're looking for council members from Region 5, which is Atlantic Canada. And I thought, I think I'd like to do that. And very quickly became involved with council, subcommittees of council. And the great thing about the Royal College is when they give you leadership opportunities, they pair it with leadership development.
Okay.
So we do a lot of governance education, a lot of opportunity to learn. And then you're surrounded by some very affluential leaders in medical education who you find out are very, very kind people who are willing to share their experiences with you. So that's what's kept me involved with them over time. And I've continued to do leadership development because I think there's always room for us to improve. I do some work now with our medical regulatory authority. So each province, so it's in my province, it's the College of Physicians and Surgeons of Newfoundland and Labrador, really to kind of give back my leadership skills, but also to understand some of those complexities as well. And that I think enhances my work that I do with the Royal College, and I think makes me overall a better physician and leader within my own healthcare system and university.
That's awesome. And for the medical students who are, passionate about leadership and advocacy, do you have any advice on how you mentioned opportunity is important about getting involved so early in their career?
Yeah. So look for an opportunity. Even in your first year class, they're going to be looking for people to sit on committees. Yeah. And committee work is leadership work. Yeah. And that's when you learn by observing how committees function. You can be a leader without being the head of that committee. You can learn how to present your ideas. You can learn how to work with people. You can learn how to affect change. And then seek out those opportunities. There may be something in your provincial medical associations. So for me, like the NLMA, there's a lot of opportunities through your medical school class. There's opportunities through the Canadian Medical Association. They may be looking for people to go to conferences such as this as a student. So really just to build on those. And as you do that, think about leadership development. So just like I need to continually do professional development in breast cancer, I need to do the same in leadership. So I like to try and do a leadership conference once a year, once every 2 years. I read the Harvard Business books. Like that's what I'll pick up at an airport because there's so much to learn from that literature as well. So always being curious, reading, and find a leader. Ship mentor, right? Ask if you can join a committee. I did some work with our internal medicine residents and offered them opportunities, for example, to shadow me as a chair of our medical advisory committee. Right. See if even if you have committees within your university or your hospital who don't have a medical learner on it, ask the question why. And even if you can just go as an observer, I think it's another way to learn.
Yeah, that's awesome. And so it sounds like developing leadership for medicine doesn't necessarily have to be developed by leadership in medicine.
So we can learn a lot from other leadership. Yeah, awesome. For sure. Yeah.
When you were in medical school, how did you see your balance between clinical practice and other aspects such as leadership?
Honestly, when I was in medical school, we never talked about anything except for learning how to become a physician. And it wasn't until later, until really I started in my career that I really became aware of these other important aspects of being a physician. And it was around the time CaRMS was first coming out, and I think it was what I have learned is that those other aspects, medical education, leadership, advocacy, are shaped by your experiences as a physician, but they also shape you as a physician. So it's a really neat interplay between those different aspects of us. And I approach them all the same, with an open mind and an open heart. How can I become better? Right. I have a personal motto, and it's called learn more, do more, and be more, because I think those are the really important aspects. If you want to take on a new role, learn about it, educate yourself around it, stay up to date, do more, volunteer, become involved, sign up for things, put your hand up, in moderation, because then you have to learn how to say no.
For sure.
And then that allows you to be a better rounded person. I also tell my mentees just to to be yourself in all your different interactions. Bring your genuine self to your role as a physician, and bring that same genuine self to your roles as an educator or a leader. And then that's what allows you to do those things all together, because you're just you doing all sorts of really interesting things, and it helps to integrate those things into your day. When I can go teach, I just feel so lifted. And sometimes after a really busy clinic, and I think, oh, do I really have the energy to bring to a meeting or to bring to a session with the medical students? You'll often leave that interaction invigorated. Because I think, and I also say, always bring it back to patient care. No matter what you're doing, ultimately, you want to be able to be a better physician yourself and educate people to be better physicians, whether they're medical students, your colleagues, your allied health care professionals, to really enhance patient care. And if you stay grounded in that, you'll always be headed in the right direction in everything you do.
It's very insightful. They're taking a step back into CaRMS because I think that's something that's, around the corner for me and for many medical students and those upcoming as well in the future years. Do you have any advice for students from your own CaRMS experience or from any work that you've done on residency committees or anything like that, in terms of reference letters, CVs, personal statements?
Yeah. So I'll just tell you, when I applied for all these things, there was no such thing as CaRMS. So I think CaRMS is an improvement because it gives a very level playing field and a very an opportunity to be considered with all your peers at the same time. So in terms of, I think probably one of the challenges is knowing what you want to do. And so even at the time of CaRMS, and as I said, I applied to do internal medicine and family medicine. So if you're not sure, apply for the things that you're really sure that you want to do. I think most of us have a short list. Gain experiences in those areas, either through your own rotations or by doing elective in those areas, and get to know people when you're doing that. Let people know. Say, hey, I'm really glad that I'm on my internal medicine rotation with you. I really am interested in internal medicine. What advice do you have for me? Then you go and do your elective in gastroenterology. You say to the people that you're working with, I'm really interested in doing GI. What advice do you have for me? Look for projects to do, but they don't absolutely have to be in your area of interest. It's when we're reviewing students, we like to see that they have been involved, that they've done things other than medical school, but you don't have to do it all. And when you write your personal letter, be genuine. Tell us who you are, because that's what we want to know. I think that when I read a personal letter, I want to feel at the end of it that I know exactly who this individual is, and I know a little bit more about them, and then I can sort of see how their career will unfold. And it's okay to seek help as you do those steps. Some of your greatest peers are going to be the people who are a couple of years ahead of you, right? So you're on service and you have a resident and you say, look, would you mind having a look at my personal letter? How does that sound? Do you know who might be a good person for me to talk to in within our faculty? The other advice that I would say is that Canada is a pretty small community. So if you're interested in doing a subspecialty or you're interested in anesthesiology and you are interested in a certain area, talk to your local anesthesiology group and say, do you have any colleagues who are in Ottawa? And, do you have anybody who do you think I could go do an elective with? And so, the community is small enough that you can make connections through people that you know.
Right, that's cool. And earlier you mentioned kind of bringing forward your genuine self on rotation. Do you have any tips for how students can prepare in terms of kind of maybe the clinical or academic side for a rotation in medical oncology, for example? Anything that might help them stand out on a rotation with you for someone who's looking to do medical oncology or internal medicine?
So just be curious.
Yeah.
Show up. show up with as I said, with an open heart and an open mind. I was just attending a session on how to ensure that faculty give feedback.
Yeah.
And I think we place a lot of onus on the learner because you're coming and asking us, but just come to clinic and sit down and take 2 or 3 minutes to introduce yourself, say what you've done, what you'd like to get out of the day, and why you're and what EPA you might want to do, but also, at the end, just take a couple of minutes and say, I'm really interested in this. I find that students who ask questions, we really enjoy that because we want to teach and we want to learn from each other, and so you don't need to have all the answers. I sometimes have someone who comes and they've looked up the patients that I have for that day and maybe have read a little bit about breast cancer. I don't need you to know everything about everything, but showing that you've taken the time to prepare a little bit for the clinic, have that dialogue at the beginning about what you would like to get out of that, because we're not always thinking like that as physicians. Sometimes we're just thinking about how am I going to get this list and how am I going to get to grand rounds and how am I going to finish up everything I need to do by the weekend, and because I have a Friday morning clinic. But sometimes it's really good to have the learners really ground us and say, hi, I'm Mark, I'm here. I'd really like to learn this. I'm interested in medical oncology, or I'm interested in internal medicine, or I'm interested in surgery, because there's so much overlap between all the things that we do. Yeah.
Awesome. Okay, well, thank you so much, Dr. Laing. I think that's all I have, at least. It's very appreciated to give us insight into your career journey and your leadership development as well. So yeah, thank you so much for joining us today.
Thank you. I really enjoyed our conversation.
That's great. Thanks so much, Dr. Laing. Once again, thanks for listening to the Specialty Cafe podcast by the Royal College. If you're currently in a Royal College affiliated residency program, be sure to sign up. It's free and there are loads of benefits. Thanks. See you next time.